Hello, everyone. My name is Haroon, and I'm the co-founder and CEO of Epilert. So Epilert stands for Intuitively Epilepsy Alert, and we're trying to make a revolution not only in epilepsy, but in neurological monitoring in general. So the whole story of Epilert started when our co-founder's sister was suffering from epilepsy, and we saw the big issue behind, but also the opportunity that we can take and explore. So we are offering a bracelet that detects and monitors epilepsy seizures. The two problems that we are trying to solve is that usually an epilepsy patient faces a seizure like suddenly, and this might put his life at risk. So 1 out of 1,000 person epilepsy patient die each year because of an unexpected seizure. So the idea is to alert the patient, the caregiver instantaneously about the seizure, and then the caregiver will act and call 911 if he's not responding. The other issue that we are trying to solve is personal safety. So an epilepsy patient suffers from a big issue that his doctor does not know a lot about his disease. So the idea is to bring data to the doctor to do a better diagnosis and consequently a better treatment. So we're offering a bracelet for seizure detection. It's a hand wrist bracelet that helps the patient through his life. So basically our device has 5 sensors. We have accelerometer, gyroscope for movement, then we have heartbeat, we have temperature, and we have what we call EDA sensor, which is a sensor that through the skin conductance can give you a derivative of neurological activity. In addition to that, the bracelet is basically linked with the mobile app, and then from the mobile app also linked to the doctor dashboard. So the patient can log his also daily habits through the mobile app, and the caregiver has an interface obviously to get notified whenever his beloved is facing a seizure, and he will know his location instantaneously. This is the doctor dashboard. We are using Microsoft Azure as a technology to store and visualize data. And then our business model consists of selling the bracelet itself for $170, and it costs us around $60. In addition to that, we have a monthly subscription fee of $10 per user. So this is the market size. So we're talking about $2 billion US dollar market in the United States alone of epilepsy patients. However, we aim to scale on neurological disorders and mental health, which a market that stands for plus $100 billion in the US alone. So the scalability, we're talking about the behavioral health market, which stands for 240 billions by 2026. Anxiety is affecting 40 million person in the US alone. And there's nothing on the market today that can help you to track your neurological and psychological well-being. So our market penetration strategy obviously will start with epilepsy as a niche, and then diverge to other disorders and general mental health monitoring. So basically we're going for a crowdfunding campaign on Indiegogo to assure some traction pre-orders. We're also going through FDA clearance. We are a type 2 510K, and we'll be partnering with insurances and healthcare systems for the distribution. Our barriers to entry are patents and data acquisition. Basically, the more data we have, the harder it is to compete with us. We have one direct competitor, which is Empatica. We have more sensors, where we offer better accuracy, basically, and we sell for less. We are looking for $500,000 round as a seed investment. We're also looking for partners that will help us with distribution later on. Most of the money will be spent on FDA and CE marking clearance. We're also recruiting some talents and spending some money in R&D. This is our roadmap. Hopefully by next summer or the fourth quarter of 2021, we will be selling, and we'll be raising a Series A in the third quarter of 2021. The exit strategy obviously will be a pharma or tech acquisition. A tech acquisition would be integrating the technology in an Apple Watch or whatever watch it is. A pharma would be interested in us because of our data, because it can help them doing better drugs and optimize their cures. We have a talented team. We have 10 people working full-time. Myself as a CEO with a background in computer engineering and international comparative law. My co-founder, Amin, who has a background he has an MBA in HR and he's experienced in operations. We have a full-time doctor who's basically our medical researcher as well. And then we have a CTO who understands everything about computer engineering, basically from software to embedded system to electronics, since we are a comprehensive solution. We have board advisors from Google, Abbott Labs. We have also a professor of neurology with us. We have secured a 100K in terms of angel investing. We have a lot of partners that are helping us through this journey that is not easy and long, to be honest. So we have Merck Pharma, the German Merck. We have Siemens Health. We have some hospitals, some institutes of neurology. We have Microsoft in terms of technical support, NVIDIA also helping us with hardware and AI, Analog Devices, Arrow Electronics, who have been ranked 5th in the MENA region according to World Economic Forum, and we have also attended an acceleration program in the Silicon Valley and ranked 4th out of 75. So Epilert is more than a technology. We believe that we are a magic flower. Thank you.
Okay, thanks, Hardun. Okay, Hardun, one quick question. Do you have any patents?
We are filing patents this month, actually. We have drafted 3 patents and we'll be filing them later this month. And this is, by the way, this is the prototype. This is our prototype. Just happens that it's next to me.
Okay. David,
I have one question.
Yeah, sure.
Just you mentioned you are involved in the Silicon Valley Accelerator. Which accelerator are you in? And about your fundraising needs. So what is your usage of the proceeds?
Sorry, could you repeat that? I didn't hear you well. Sorry.
Which accelerator you were in? When did you graduate from it?
When did we what? Sorry.
You mentioned you were involved in the Silicon Valley Accelerator.
Accelerator. Oh, okay. Yeah, it was 2019 at the end of, it was November 2019.
Which one?
It's a Draper University. It's an acceleration program for entrepreneurs. Yeah.
You're in Draper, you know DU, right? I know DU very well.
Exactly. We have been ranked 4th out of 75 in that program.
Okay. Okay. So for the $500,000 you are raising, what is the use of the proceeds? What's the plan?
The plan is basically the following. The problem is that we have high barriers to entry, which is obviously regulatory barriers, the FDA clearance. The idea is to use this money to get FDA cleared and start selling. In the meanwhile, we'll be developing and creating our community. We'll be launching a crowdfunding campaign that is aimed to build basically a community and gain early traction and make a revenue, since we are pre-revenue, as I mentioned. We are also expanding the team. That's basically the plan. If we start today, so we have started already with some FDA documentation and risk management, will be cleared by next June, I would say, at the latest next August. And like when we get cleared, we'll be raising Series A, since our valuation will be at least 3 to 5x higher. Anyone has another question?
Yeah. So see, you're as part of this device, right? As a wearable, you'll be capturing a lot of data, right? Is it a reactive data analytics platform or is it predictive?
Yeah, so basically it's two things. It's detection, so seizure detection. Basically, once a seizure happens, there's the shaking, there's a lot of biosignals that change. We detect
Right.
seizure, and then we alert friends and family of the patient instantaneously. The other thing that we do is monitoring. So we are acquiring data anyway, right? Why we don't give the doctors the feature to monitor their patient closely? It's kind of
Right.
telemedicine. It helps them with seeing the historical data and how many seizures did he have a month, a week, etc. So gives them a lot of insight, like it helps them a lot with treating the treatment of the patient.
Are you able to predict based on this data?
Okay, so the prediction itself, we are not at this stage. We are at the stage of detection. So once the seizure happens, we detect the prediction needs time. So we need data in order to predict. It's how
Right.
AI work, right? You use the data in order to recognize patterns and predict. The prediction can be up to 1 minute before the seizure, which is great
Right.
because it allows the patient to have a time to get in a position where he does not harm himself. Imagine if someone is driving or maybe having a shower, he can get a position where he does not harm himself.
Right. Got it. Yeah. And any other disease you are going to tackle after this
Yeah,
with this variable?
exactly. So great question. The scalability model is that there is other neurological diseases like Parkinson, for instance, and then you have the mental health monitoring, because this sensor that you're talking about can tell you if you are stressed, depressed,
Exactly.
anxious, or whatever. So,
Exactly. Yeah.
so this is a bigger market. It's a way bigger market,
Right.
and that's the path that we're starting from a niche, then
Right.
scaling up on a bigger market once we prove ourselves in this niche.
Right. Because most of these behaviors are attributed to some psychological changes, right? Emotional changes. So
Exactly.
you have enough data points to predict that. Okay, great. Great. Upasna, you're there?